Hi, and welcome to my podcast, the Fertility, Motherhood, and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. Lena is 45. She's excited to start a new phase in her life as the children leave home and she has more time for her other interests. She's looking forward to traveling and taking a computer class. But recent health changes have been getting in the way of her plans. Lena has been having irregular periods for the past few months. Now, she's getting hot flashes and having trouble sleeping. The hot flashes, which cause her body and face to heat up quickly and uncomfortably, are waking her up several times a night. She is tired and irritable from lack of sleep and fed up with the hot flashes. Menopause, derived from the Greek word root, which essentially means month. But I'm sure to most women who have gone through this or are going through this, menopause in lay terms means that time of life where a woman doesn't know if she's coming or going, on fire or freezing, happy or sad, wants to diet or eat everything in sight. Some common phrases used during this time include hot flash, mood swings, and brain fog. As if labor, pregnancy, delivery, breastfeeding, stretch marks, cellulite wasn't enough, women do have to also go through the ordeal of menopause. But that's perhaps because God knew we men aren't strong enough to handle all this. I've been a gynecologist for 20 years now, and I know what it takes to be a woman. A big salute to all you women out there. So what is menopause and this menopausal transition? Women are born with a finite number of eggs. They recruit few eggs from this pool every month. Once the egg numbers start to dwindle, fertility goes down, and when this pool of eggs is almost finished, menopause sets in. Menopause essentially means stopping of periods. Periods need to stop for 12 months for us to diagnose a state of menopause. The phase lasting from 6 months to 10 years before this final cessation of periods is called perimenopause or menopausal transition. During this time, women may face various symptoms. Let us try and understand these symptoms and those of menopause in little more details. Irregular periods. In the months or years preceding menopause, as the number and quality of eggs starts to go down, the cycle length tends to get shorter and the flow during periods reduces. With ovulation becoming less frequent, cycles become less frequent, and women start to get their periods after delays and then start to skip months, leading finally to the menopausal state wherein they don't have periods for a year. Thus, menopause by definition is cessation of periods for a year. About 8 out of 10 women will have additional symptoms before and after the periods stop. Hot flushes. So these are sudden, short feelings of heat, especially in the face, neck, and chest, which can make your skin go red and sweaty. You could be sitting in a room full of people, and while everyone is comfortable with the temperature, you practically could be having smoke coming out of your ears. This can last from a few seconds to a minute and can keep recurring throughout the day. Night sweats. These are nothing but the hot flushes that occur at night. Difficulty sleeping. This may make you feel tired and irritable throughout the day. Irritability. Sometimes this and reduced sleep may be the only symptoms initially. You may get into unnecessary arguments with your spouse or children or the staff at home. There may be other mood changes like depression or anxiety. The reduced estrogen levels may additionally cause a reduced sex drive or a reduced libido, problems with memory and concentration, and vaginal dryness and pain, itching, or discomfort during sex. There can also be other problems like joint stiffness, aches, pains, reduced muscle mass, and recurrent urinary tract infections. As I said before, most women will experience one or the other of these symptoms. That doesn't mean majority of them need to have the more disturbing symptoms like, say, hot flushes or night sweats or irritability, etc. The symptoms are sudden and more severe in those who undergo surgeries for their ovary removal, usually done along with removal of the uterus, because this causes a sudden loss of estrogen hormone and thus does not allow the body to gradually adapt to the falling levels of the hormone. So how does one know that menopause has arrived? As I said before, periods need to stop for a year for us doctors to arrive at the diagnosis of menopause. Are there tests available? Yes, there are. We do tests like AMH or anti-Mullerian hormone, which will be extremely low, and FSH or follicle stimulating hormone, which will be extremely high. But these tests can point towards menopause, but cannot prove that your periods have stopped or that they will conclusively stop within the next few months. A vaginal ultrasound done may show small shrunken ovaries. Besides the symptoms and problems that I have mentioned, are there any complications that you should worry about? Yes, there are. Osteoporosis. The bone structure in our body is dynamic with calcium deposition and calcium loss happening all through life. The deposition starts to reduce after the age of 30, and this loss is accelerated after age 45 and becomes more severe after menopause. This can lead to bone thinning and osteoporosis related fractures. Some interesting facts. Osteoporosis results in one fracture every second around the world. 61% of these fractures occur in women. 1 out of every 3 women above the age of 50 will experience osteoporosis related fracture. Even in women above the age of 45, osteoporosis accounts for more days spent in hospital than many other diseases, including diabetes, heart attack, and breast cancer. And the forearm, arm, hip, and spine consecutively are most affected in that order. The next complication one needs to worry about is heart disease. One important thing to know is that the risk of heart disease increases after menopause. So postmenopausal women are even more likelier than men to have a heart attack. And the sharp decline in estrogen levels has also been linked to irregular heartbeat or palpitations. The third problem we need to worry about is urinary problems. Urinary incontinence, that is the occasional and involuntary release of urine, is common in aging women, particularly after menopause. The decline in estrogen causes the vaginal tissues and lining of the urethra, which is a tube which connects the urinary bladder to the outside of the body, to become thin and lose elasticity. As a result, you may experience an uncontrollable urine leakage. This often occurs during sudden movements such as laughing or coughing. The loss of elasticity might just be superimposed upon the weakness that the muscles might have undergone due to repeated vaginal deliveries or because of the damage suffered during forceps or vacuum delivery of the baby. I have a podcast dedicated entirely to urinary incontinence, so you could probably look it up when you finish listening to this one. The next problem we need to worry about after menopause is weight gain. Many women experience weight gain as they reach their 40s and 50s. However, this may be due to the natural process of aging and not solely because of menopause. With age, it's harder to maintain muscle mass. Lower muscle mass slows down your metabolism, so it's easier to gain weight. But it's also true that the reducing estrogen coupled with the unbalanced increasing male hormone levels also tend to cause weight gain, especially around the hips and tummy in menopausal women. The increase in abdominal fat is particularly dangerous as it ups the risk for heart disease. I've also been asked very frequently if one needs to see a doctor when going through menopause. My answer, as always, is that there is a need for a regular health checkup every year as part of disease prevention and early detection. This should start around the age of 30 and should be done every 2 years. After age 40, it should be done every year. If one has been doing this and menopause is not causing any major problems, then one doesn't need to see her doctor specifically for this, as all the advice and treatment related to bone health, multivitamin supplementation, and early cancer detection have already been given. Of course, if one is facing any of the problems that I have mentioned in the podcast, then for sure you need to see a gynecologist. How do we deal with the problems associated with menopause? Is there a treatment available? Managing menopause really starts from the young age, from the teens. Childhood and adolescence are particularly valuable times to increase the bone mass through exercise. Higher levels of leisure time, sports activity, household chores, and fewer hours of sitting daily were associated with significantly reduced fracture rates. Good nutrition with adequate fruits and vegetables and calcium and vitamin D supplementation help, as does reducing smoking and drinking. High protein diet, of course, in consultation with a nutritionist, goes a long way in preventing muscle wasting. Coming to specific problems and treatment: hot flushes and night sweats. Wear light clothing. Keep your bedroom cool at night. Take cool showers. Avoid hot drinks. Reduce your stress levels. Avoid potential trigger factors such as spicy food, caffeine, smoking, and alcohol. Hormone replacement therapy or some medicines that reduce the heart rate and certain antidepressants work brilliantly if all of the above fail. Mood changes. Exercise helps a lot. There are a lot of studies which say that yoga and Tai Chi has shown very promising benefits. Psychologists are of great help, especially if one is a little lonely and depressed. Antidepressants, of course, are there above all else. Reduced sexual desire. Hormone replacement therapy helps, and if that is not good enough, then testosterone or male hormone supplementation can be done. Funnily, that helps. Vaginal dryness and discomfort. The treatment starts with elimination of any local infection which might be present, followed by use of local lubricant gels and creams. If that doesn't help, estrogen creams applied locally help rejuvenate and lubricate the area. Lastly, but most important, weak bones and osteoporosis. Exercising regularly, especially weight bearing and resistance exercises help. So it's a myth that older people should not exercise, should not hit the gym, or should not do any weight training. Eating a healthy diet including plenty of fruits, vegetables, and good sources of calcium. Lactose intolerance has been shown to be associated with increased risk of fractures. Go out and get some sunlight to naturally manufacture vitamin D. Stop smoking and cut down on alcohol. Take calcium and vitamin D supplements. A discussion on menopause can't end without a discussion on hormone replacement therapy and the huge fear that it has a bad side effect and that taking it means getting cancer later. I have 3 points to mention in this regard. The studies on which the whole assumption of the hugely increased cancer risk was based were found to be faulty on closer scrutiny. The women included in the study were older than the age of 60, and they were given hormone replacement therapy or HRT for more than 5 years. The women who need this usually are around the age of 50 and are only given the HRT for maybe 6 months to a year, both of which are extremely safe practices. Point number 2, statistics can sometimes be misleading. Yes, there is a small increase in the risk with long-term HRT usage, no doubt on that. But if I were to ask you how many people betrayed Jesus Christ, you would say 1. I would say 8%, since 1 out of 12 is 8%. They both are the same, but don't convey the same meaning to the listener. 3. Lastly and most important, trust your doctor. He or she knows best. We doctors have spent years training, reading, and honing our skills to be where we are. To treat without causing harm will always be our primary goal. And if HRT can cure dismal and life-stressing symptoms, or save lives by reducing osteoporosis, or can return normal sexual life to someone facing distressing problems, why walk away from it? HRT is a gun that saves lives in trained hands. You need not fear it. As someone rightly said, there is no more creative force in the world than a menopausal woman with zest. On that note, to all you lovely ladies hearing this podcast, just 3 words. You are strong. And I am fortunate that my career allows me to be part of your journey. This brings me to the end of yet another podcast episode. I hope you enjoyed listening to it as much as I enjoyed making it. If you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries. This podcast is available on Apple and Google Podcast as well as Spotify. Do subscribe and leave your comments and suggestions for any future topics on the Apple Podcast app. That's the only way we can make this better. Looking forward to great interactions. Keep listening.